Special issue, the multiple lenses on the community health system, implication for research and action, is the result of collaborative efforts by a network sharing common values and interests. Since 2017, researchers from the universities of Zambia, Western Cape, Makerere, Muhimbili, and Umeå have met on a regular basis, building our research capacity and collaborations on the theme of community health systems. This has been funded by South African NRF, Swedish Stint, and a network grant from the Swedish Research Council. The collaboration has drawn in a wider network of researchers, practitioners, and decision makers, today forming CHS-Connect. With an explicit interdisciplinary focus, this network aims to enhance research capacity and competence for designing and conducting embedded health policy and systems research in order to build inclusive, socially accountable, and resilient community health systems.
In mid-2019, we hosted a gathering at the Chaminuka Lodge in Lusaka, Zambia, where over 1 week we followed a structured process of pooling our collective insights on the elements and purposes of community health systems. The end result was a typology of 4 key lenses on the CHS, articulated as programmatic, relational, collective action, and critical lenses, representing different positionalities, purposes, and assumptions about change in the community health system. We also developed a set of research priorities and compiled a joint Chaminuka manifesto on the CHS, outlining a set of common values and ethical stances for research and practice in the CHS. There are 11 papers in the special issue, 2 of which framed the issue as a whole and were co-authored by the Chaminuka Collective, represented on the left-hand side of the slide. They describe the 4 lenses, research priorities, and joint manifesto on the community health system. These 2 papers are followed by 9 papers illustrating the 4 lenses and written by embedded researchers close to country policy and implementation processes in Zambia, Tanzania, Sweden, South Africa, India, and Australia, and represented on the right-hand side of the slide.
The papers on this issue have provoked renewed thinking on how the community sphere in health systems can be revalued so as to make it more functional. And this functioning can be defined as reaching an inclusive, socially accountable, and a resilient health system. These papers therefore bring in an understanding of the drivers that shape or worsen this resilience. Thus, this editorial identifies resilience as a common unifying intersection of all the papers and recognizes it as a significant prerequisite to community health system functioning. The resilience fabric includes the understanding of the various community components of the aspects and which can also and how they relate to become part of the enablers and or factors that help to shape community health system functioning. Drawing from the papers, it seems clear that this resilience referred to here includes processes on how to coordinate the local actors in such a way that they manage disparities, integration of community components, opportunities of holistic health, differential power bases, as well as opportunities for stronger community collaboration. In a way, the resilience dimension helps to view communities as a valued, essential, and empowered actors of the health system for managing this diversity through engagement and dialogue, and creating socially acceptable inclusiveness while it's using multiple lenses to examine context-specific dimensions so as to improve health outcomes ultimately. To add on the resilience debate, we argue that both processes and the health outcomes must be part of the description. Although resilience description keeps evolving, we argue now that it is undebatable that there exists a need to realign or re-strategize investments towards creating these and such resilient and socially accountable community health systems as a key to the overall health system functioning, which ultimately is necessary for universal health coverage.
Finally, we are deeply indebted to the International Journal of Health Policy and Management editorial team for so readily embracing the idea of the special issue. The journal plays a uniquely interesting role, not least of which is that it publishes papers from across the global North and South, and has an epistemic inclusivity that mirrors what we believe is required in policy practice and research on community health systems.